Welcome to another section of the iBerkshire's Download, where we talk about important issues facing the county. Today we're going to talk about the opioid crisis, and I know a lot of people have heard that over and over again. We have an opioid problem. Well, I think we need to keep talking about it because it is affecting everything in this county and everybody in this county. And to give you a context of how this has changed, in the year 2000, there were 379 overdoses in the state of Massachusetts. In 2016, that was nearly 2,100. Now, the numbers have leveled off, but if you ask first responders, that's not what they're going to tell you. So we have Brian Andrews here. He's the president of County Ambulance. And tell us, what are you guys seeing?
We are seeing in 2019 an increase in the overdose that we are seeing, the overdoses. We're seeing an increase in Narcan administrations, and anecdotally, we're seeing an increase in the number of deaths that appear to be related to overdose. Unfortunately, we don't get that data immediately. That has to go to the state and such. But it's pretty obvious when you go to some of these dead-on scenes what the result of the death, the cause of it has been. So same thing happened for 2018. Well, the state is saying, they haven't rolled all the data out yet, but they're saying that they saw a reduction in overdose deaths. It doesn't appear that way to us here in Berkshire County, and especially here in Pittsfield and surrounding.
Yeah. And in the last handful of years, I think it was like 2014 is really when the state came out and they termed it a public health crisis. And one of the big things that came out of that is the use of Narcan, the overdose reversal drugs. And that's been put in the hands of first responders, police department, fire department, paramedics, and EMTs. More and more are carrying that to help save a life. So that probably contributes to the numbers. Would you agree?
Absolutely. The widespread availability of Narcan has helped in many ways. But I think there's been changes in the product that sometimes gets delivered into our area, and so we see contaminated, if you will, doses of heroin that people encounter. You're also seeing more people who enter recovery and sometimes relapse, and when they relapse, they go back and use levels of drug that they previously were when they had a bigger tolerance. In terms of the Narcan use, the number changes are phenomenal. We have seen a 60% increase in the amount of Narcan that just our company is administering this year. But the reassuring number is we're seeing a 90% increase in the amount of administrations that occur before we get there. So families, friends, bystanders have this wider access to Narcan, which is saving some lives. So I'm pretty confident to say that those overdose deaths that we are seeing would be much higher if it wasn't for the Narcan.
Now, we've written about a program you're running about, you're rolling out before, but I think it's definitely worth highlighting right now because people think of paramedics and EMTs as they show up on the scene, they take you to the hospital. That's kind of all they do. But there's obviously so much more to the profession. But the program you guys are doing is really helping not just save the life that day. It's trying to get them into those recovery programs and into to get the help they need. So this is a post overdose follow-up program. So can you just give me the rundown? How is this going to work?
Sure. The way we have approached it and the proposal we have is that now with some changes in the ambulance regulations in Massachusetts, we can have a more proactive approach in terms of follow-up with our patients. Our hands were tied before, so we couldn't really approach patients after we took care of them. So we are going to have a program where we have individuals within the company who receive special training, who will go out and hopefully meet with these patients who either have overdosed, received Narcan, or have an opioid-related condition, and offer services. It's not only, first and foremost, yes, we'd like them to think about going into recovery and treatment, but we're also going to offer harm reduction techniques so that we can deal with some of the other issues that surround overdose. Not only, death and trying to have them stop using drugs, but also to safe needles, using clean needles, getting rid of needles in a safe fashion so that other people don't become infected, and all kinds of harm reduction techniques that have an overall impact on our health picture within our area.
Now, there's something about this that really kind of seems special to me is that these are, EMTs, these are paramedics, these are people who were on the scene, when somebody, when the opioid issue has led them to go to the hospital and they need medical treatment. And so do you feel there's something special about be able to have that EMT come back and be like, hey, we want to help you so we don't have to, keep doing this and you have to keep getting taken to the hospital?
Sure. And that was kind of the way this came to my mind one day was, we've seen situations where people that we've reversed their overdoses are very thankful. Mm-hmm. Sometimes they're not. They're not ready for recovery. They're still in the throes of the disease. But they are, some people were ready for recovery, and having that bond where you've just saved their life, sometimes I think is going to have the ability for you to have a little more success mm-hmm. in convincing that person now might be the time to seek treatment and enter recovery. That's my whole thought process that got this going mm-hmm. When we first started talking about it.
Yeah. So, and now there was, before we started filming, we were talking about sort of where this problem is. And I know for years, a lot of people thought this was just a city problem. This is just that sort of, 20-year-old in an alley kind of thing. But this spread throughout all demographics and all regions, particularly in the rural communities. Where are you guys seeing these issues?
We're seeing it everywhere.
Mm-hmm.
Certainly at its height, it's been in the city, mm-hmm. Where drugs are a little more accessible, things can be done a little more anonymously. But we're now responding to communities that we've never been in before, towns mm-hmm. like Lanesboro, Washington, those small communities that never had this problem are now seeing it. Mm-hmm. And it's kind of interesting that nationally that hasn't been the trend the last couple of years. Rural areas have had the highest overdose numbers, mm-hmm. And CDC just came out this week and has said, well, those rural numbers have gone down, and now the city numbers are, urban areas are starting to surpass that. Mm-hmm. Although the overall reduction is small, has increased.
Mm-hmm. So, do you have any thoughts on why that trend has changed a bit, or is it just sort of trying to figure it out?
I think it's all about trying to figure out, this part of this whole problem has been it kind of crept up on us real quickly. Mm-hmm. And so even data collection, I'm a huge data person. I believe that's what drives us in healthcare is what we see for numbers. And quite honestly, until a few years ago, there weren't even categories for heroin or opiate overdose mm-hmm. in our reporting software. Mm-hmm. So trying to collect data is been very difficult. Mm-hmm. So I'm not sure we have the answers to all the questions still.
Mm-hmm. So now, we'll get back to the program a little bit. You had to get local approval. So where are you in the process, and when can your employees start going through these trainings and start putting these follow-ups into action?
So there's a multi-level process involved with the application with the state. Mm-hmm. This is a new process that just started in October of 2018. Mm-hmm. So it took us a little bit of education to get up to speed on the application, but it involves ensuring that the Board of Health in your community is aware of what you're doing, mm-hmm. And that's to ensure that you're tying it in with all the community, activities that are happening. Mm-hmm. I think that's been one of the problems with this is sometimes everybody's operating in their own little world, and mm-hmm. we don't tie in how we work together. So the Board of Health
wants to do something.
Exactly.
And everybody wants to do something, so you got to bring them all together.
So there was a heavy emphasis on Board of Health approval. So we went before the Board of Health, got their approval, received their signatures. Then I went to the mayor, and she welcomed it with open arms. Mm-hmm. That she understands the problem. She approved it, and then we had to go to our medical director, our doctor that mm-hmm. oversees our service. He has offered support, and so now it's gone off to the Department of Public Health in Boston. Mm-hmm. Under the new regulations, they have 30 days to approve it. Mm-hmm. I've been told unofficially that it will be approved without fail because it's part of the opioid, process. So I'm hoping within 30 days we can move forward. I was trying to be very optimistic that we could be ready to go by August 1st, but the way things work, it didn't happen. But I'm hoping by September 1st or very shortly after, we'll be starting all the activities surrounding this.
And what do your employees feel about it?
It's like society. I have mixed reactions. I have some people very positive about it, want to help, want to be involved. And then you have some that are a little skeptical. They don't fully understand the whole issue. We all have our perceptions of opioid addiction. So we've got some education to do with our healthcare providers. And, and there's also the concern of their safety. Some of these places where we get overdose patients are very dangerous locations. They're really shooting galleries, places where people just go to inject medication. So, it's mixed, but mostly positive. And like I tell my employees, I don't care if I have to go out and do it myself. I am so convinced we need to do this, that we're going to make it happen, and we will.
Okay, great. Well, this has been a great conversation, Brian, and hopefully this program, gets up and rolling soon, and the state, crosses the T's and dots the I's for you. So,
thank you for your support in getting the word out on what we're doing.
Oh, absolutely.
That helps.
So, all right, thanks a lot.
All right, thanks, man.